see. Ready? Okay. Hi, everybody. I'm Joan Walton. I'm a bachelor's student at Alfred, and I work here at the hospital, and I'm doing my capstone this semester, which is almost at the end of the bachelor's program. And one of our things we had to do was a project. We had to research a healthcare foundation. We had a choice of 4. I chose cystic fibrosis for my research choice. So what I'm going to do, I'm going to just run through what I'm going to cover here today. I'm going to define the disease and the incidence and prevalence of the disease, how the disease is diagnosed, the symptoms and manifestations of the disease, treatment, prognosis and prevention, and then I'm going to look at what the CFF is, the Cystic Fibrosis Foundation, the history, the local chapter, fundraising efforts, the registry that they create, current evidence-based practice related to exacerbations of cystic fibrosis and related research. Okay, so let me turn this thing on. All right, so my research goals was to increase my understanding of the complexity of CF and the disease progression. I haven't never taken care of a CF patient, but we have a lot of patients here that have respiratory issues, COPD, pneumonia, and what they have in common with CF is impaired mucus clearing capabilities. They cough and they can't get it up. So that's one of the things that happens with a CF patient. And I also wanted to gain knowledge in relation to what the CFF, the Cystic Fibrosis Foundation, how they support the patients, their patients, and aid the population, and particularly to this area. So I'm going to define cystic fibrosis. It's a chronic progressive multi-organ affecting genetic disease due to the faulty CFTR gene. The CFTR gene produces cystic fibrosis transmembrane conductance regulator and a protein. And a defect in this gene causes impaired water, sodium, and chloride flow out of the cells. So the chloride stays in the cells, and that leads to sticky, thick mucus in multiple areas of the body, not just the lungs. And this picture just shows you a normal flow. The chloride comes out of the body, and impaired flow, it doesn't come out of the cells. The incidence of CF, it occurs equally in males and females. If both of your parents have to be carriers of the gene, if your parents are carriers, you have a 25% chance of not being affected at all, or of contracting, probably isn't the word, of ending up with CF. You also have a 50% chance of being a carrier if your parents have the trait, the genetic trait. The prevalence of CF, there's 30,000 people in the U.S., which is 1 in 3,700 children or adults have CF. Worldwide, the prevalence is 70,000, which to me, we have almost half of the world's population in the U.S. Approximately 1,000 new cases are diagnosed each year, and it affects nearly every race, but it's more common in Caucasian of Northern European descent. 1 in 2,500 Caucasian births are affected, and 75% of the new cases are diagnosed by the age of 2. Diagnosis of CF is based either on blood test or genetic screening. The genetic screening reveals a faulty, the CFTR gene. The blood test reveals inadequate pancreatic function. And then the way they confirm the diagnosis is through the sweat test. In the sweat test, they put chemical on your skin, and they put an electrode over top of it, and it causes you to sweat more, and then they analyze your sweat for salt content. Systems affected by CF. People with CF often have sinusitis, inflammation of the sinuses. That's a chronic problem. Their lungs, they have chronic lung issues due to the buildup of mucus. They're not able to expectorate it, and that leads to bacterial infections. Their skin is often affected because they have an increased salt content on their skin. They often have biliary problems with their liver, which is due to the mucus. And also with the pancreas, they have blocked pancreatic ducts. And what happens with that is the pancreas excretes enzymes, and you need that for digestion of your food. So in the intestines, you can't fully absorb your nutrients because your enzyme coming from your pancreas isn't producing enough to make you digest your food adequately. And also in the reproductive system, people with CF often have fertility problems. And this picture is just showing a normal airway and then a CF airway, which has increased mucus, and a lot of times they have blood in their sputum, and like I said, they can't cough up the sputum and they end up with bacterial infections. Other complications with CF is bronchiectasis, which is dilation of the bronchial tubes. After coughing, years and years of coughing and having this problem, they end up with that problem, the bronchiectasis. They have chronic infections, nasal polyps, blood in their sputum, which is hemoptysis, pneumothorax, and respiratory failure. In the GI system, they have nutritional deficiencies because they're not absorbing the nutrients due to the inadequate enzyme functioning. They often have diabetes, rectal prolapse, and intussusception, which is a telescoping of the bowel that is often in little kids. And other complications are osteoporosis, which is probably due to inadequate calcium absorption and electrolyte imbalances. Once they're diagnosed, a person is diagnosed with CF, they will do genetic testing to see which defect they have, because there's multiple defects, and that will predict or determine treatment in some cases. They will do a chest x-ray that can reveal lung inflammation, scarring, and air trapping. They'll do sinus x-rays to look for sinusitis, and they'll do lung function tests, inspiratory and expiratory capacity, respiratory rate, and they'll look at the blood oxygen levels. They'll do a culture of the sputum to look for bacteria, and often, especially in older people, I should say teens on, Pseudomonas may be present, and Pseudomonas infection often will indicate increased incidence of mortality and morbidity. For someone who's either a child of a carrier, they may want prenatal genetic screening, and that would be done by amniocentesis or chorionic villus sampling. And also they may want to be tested just to see if they have the gene present before having children, possibly. And the CTFR gene testing for that is accurate in 9 out of 10 cases. Care and treatment in CF, specialist care is recommended, and you can only generally get that at major medical centers. There's greater than 100 CF care centers in the United States, and a treatment team consists of nurses, physical therapists, dietitians, respiratory therapists, and social workers. And there's programs that they treat children and adults, and the clinics are different depending on the age of the person. Treatment goals are to prevent and control lung infections, loosen and remove thick, sticky mucus from the lungs, prevent or treat intestinal blockages, provide adequate nutrition, and prevent dehydration. And this graph, I don't know if you can see it real well, but it just shows the age beginning at 1 and it goes up to 45, and it shows you the incidence of bacterial infection and what it is, and how it changes from staph, Haemophilus influenza, or this I've never seen that, Burkholder or Capacea. It changes from that to Pseudomonas as the person gets older. And the incidence increases also. Treatments in CF, one of the primary treatments is chest physiotherapy, CPT. It's synonymous with postural drainage and percussion, which down here, the baby down here, they're showing postural drainage, which is they put the head down, and they often do, if you ever saw, they do this kind of a thing on the patient's chest to knock the sputum loose. That's when they do it manually. There also can be hooked up to an electric chest clapper or a mechanical percussor. Mechanical, they have these little plastic disc things that they use rather than your hands. And the other thing that works similarly to it is the flutter valve, which you probably have seen out on the floor. And then there's inflatable therapy vests. Some of the vests are that you're not connected to anything, they're battery operated. So that's one of the primary treatments in CF. Another primary treatment is they recommend exercise to improve physical condition, and also exercise, in this case, the increased breathing helps loosen mucus and helps them cough it up. Other treatments include antibiotics. They can be oral, inhaled, or IV. Anti-inflammatories are often ordered. Mucus clearing medications are ordered. And the one that's specific to CF is this Dornase alpha. It's a mucolytic that's inhaled, and that means it breaks up the mucus. And the other thing that we see often is bronchodilators. One of the treatments for CF that actually targets the cause, because all the other treatments are basically treating symptoms and manifestations of the disease, but this ivacaftor is a drug that actually targets the cause. It targets the CTFR gene and its protein products. Only children over 6 years can be prescribed this drug, and it has to be someone with the G551D mutation, which occurs in 5% of the population. People who have CF are recommended to have pulmonary rehab, and that will improve their functional capacity, well-being, and life quality. It includes exercise training, nutritional counseling, disease management education, energy conserving techniques, breathing strategies, psychological counseling, and group support. Another treatment in CF, due to the digestive problems that people have that are usually, they have bulky stools, swollen abdomen, gas, severe constipation, pain and discomfort, and they have impaired growth and development. And the treatment for that, they recommend a well-balanced diet rich in calories and fat, because these people have a hard time keeping weight on, and also a diet rich in protein. Pancreatic enzymes are often prescribed, which Creon is an example, the pill there is an example of a pancreatic enzyme that's prescribed, and that helps break down the food, and it enhances fat, protein, and carbohydrate absorption, and digestion and vitamin absorption. CF patients should be taking fat-soluble vitamins, the D, A, K, and E. Their diet should be high in salt. When they exercise, they should take a salt supplementation. Nighttime feedings are often indicated for those who have a hard time keeping weight on. And mucus thinning medications may be needed for intestinal blockages. And often stomach medications that reduce stomach acid are prescribed to increase the effectiveness of pancreatic enzymes. Oops. Oh, okay. Make sure. Okay. So treatment in advanced disease is oxygen and lung transplant. Prognosis and prevention. Nearly 50% of the CF population today is over 18 years old. Survival rate age is nearly 37 years. And in 2013, the primary cause of death was cardiorespiratory and transplant related. Early identification through newborn screening has increased survival rates, improved lung function and growth, and has led to less intensive and cheaper therapy. So now we're on to what is the Cystic Fibrosis Foundation. They're a nonprofit donor-supported organization dedicated to attacking cystic fibrosis from every angle. Their mission and focus is to cure cystic fibrosis. They believe that all cystic fibrosis patients should have the opportunity to lead full, productive lives, and they want to facilitate that through research funding, drug development, promoting individualized treatment, and ensuring access to high-quality specialized care. They are a world's leader in the search for a cure. They're leading research funder. They were established in 1955 in Philadelphia, Pennsylvania, by a group of parents of cystic fibrosis children that were looking for a way to fund research through grant money. At that point in time, children rarely lived to be old enough to go to elementary school. And today they're based in Bethesda, Maryland. Through their research in 1989, the Cystic Fibrosis Foundation discovered the CTFR gene. And that was, I was thinking, about 35 years after the foundation was established. And They fund and accredit national care center networks that are recognized by the National Institutes of Health as a model of care for chronic disease. And this just shows, prior to 1955, there was next to no treatments for cystic fibrosis. And then as the years went by, up until 2010, the age of the survivors have increased based on being able to treat the disease, all the advances in treatment. So as I put at the bottom, as treatments became available, survival rates increased. In state and local CFF champions, there's 70 chapters across the country, 70 chapters in branch offices. Locally, there's a chapter of Western New York, the CFF chapter of Western New York, serving Allegheny, Cattaraugus, Chautauqua, Erie, Niagara, Orleans, and Wyoming counties. They partner with community supporters to raise awareness and hold fundraising events. Some of the fundraising events that they do nationwide are Great Strides, which is a walking fundraiser. CF Cycle for Life is biking. Finesse events, it gets what do you call them? Leaders, young leaders in the community, and educates them on CF, and it's basically trying to get them involved so that maybe they'll help design a program in the local community, which will help raise funds. Extreme hike, dinner, dances, and galas are held. Golf tournaments, CF Climb, where they do it in stadiums. They do the stairs, and sometimes they do it in high-rise buildings. Fishing tournaments, America Airlines Celebrity Ski, and Ultimate Golf Experience. In Arlington, Virginia, there's a high school that's been doing fundraisers for 40 years, and so over the course of 40 years, they've raised $3.9 million to aid research. And people with a lot of money can donate to the Milestone Club for private donations. Locally this year, there's some events in the summer and fall. There's a fishing tournament in June, golf tournament in August and September, and then there's a dinner recognizing women with CF in Western New York. The CF has a registry that they put out every 2 years, which this is the year for the registry to come out. The last one came out in 2013, and in that registry it contained data on 28,000 patients, and that is 30,000 was the number of people in the United States. So they have 30 minus 2,000 people, if that data is exact. But the registry was created 50 years ago. It collects data for patients receiving care at CFF accredited centers. The data is collected on health outcomes, clinical care, and demographic characteristics, and it's used to develop care guidelines and study treatments and outcomes. And it's also used to design clinical trials and for quality improvement initiatives. So the CFF committee worked together to establish guidelines for CF exacerbations, and there's 10 guidelines that they came up with, and I didn't go through every guideline because it would have took too long, but I had to choose one guideline and show you the research, how they came up with the information, how they came up with their recommendation. This right here is the reference. It's Pulmonary Perspectives on Cystic Fibrosis Pulmonary Guidelines for Treatment of Exacerbation. And their first recommendation is that they felt that non-hospital setting IV antibiotic delivery, which would be home setting, is not recommended unless there's adequate support in the home that's equivalent to a hospital setting. And the way they came up with that recommendation is they looked at these 2 research articles and then came to that conclusion based on the research articles. In these articles, I just compared them. The first article, the patients that were looked at were of similar age, disease severity, and in the second article, it was adults and adolescents and with COPD exacerbation. So these studies weren't the same. You weren't comparing apples to apples in these studies. There was 5 patients in the first study and 17 in the second. There was 23 home care courses in the first, 13 in the second study, 33 hospital courses in the first, and 18 hospital courses in the second. Both studies, the patients received IV antibiotics. In the first one, they had CPT. In the second one, they had physical therapy. Outcome measures for the first one was pulmonary function. It was forced vital capacity and forced expiratory volume changes. In the second one, they had more criteria that they looked at. They looked at body weight, 12-minute walking distance, 12-hour sputum production, pulse oximeter, and lung function improvement. The first study looked at treatment length and the interval between antibiotic courses, and they measured their lung function at the start of the treatment and after 2 weeks. The second one, they looked at treatment at the outcome measures at the onset after 10 days and 10 days following treatment. Their findings, the first study felt that mentally supervised home care was less effective than hospital care. Home care increased care costs by as much as 30% due to longer and more frequent courses of antibiotic treatment. The second study did not find any clinical advantages to being treated at home, but it was the advantages were all quality of life related. And that study actually felt that home care was less costly than hospital care. So I think that the people who did the research were looking at the effectiveness of the treatment and not quality of life. So these are the local chapters. There's one in Rochester, one in Buffalo, and one in Syracuse. And that's the end of my presentation. I hope you all learned something from it. And there's some questionnaires here, or evaluations here, if you can fill one out. And if you have any questions, maybe I can answer them. I'll try to answer them, okay? Thank you.